Hi, my name is Caprice Rengifo, and I'm going to talk about hepatitis B virus, rtl233v, mutation, and resistance to adefovir. Definition. Hepatitis B virus infection is preventable through effective vaccination. It remains an important cause of morbidity and mortality globally.
Now let's look at hepatitis B virus. It reproduces in the liver, causing inflammation and even possibly cirrhosis, liver failure, and then liver cancer. When first infected, a person can develop an acute infection, which can range in severity from a very mild illness with few or no symptoms to a serious condition requiring hospitalization. Acute hepatitis B, which means sudden onset and short term, refers to the first 6 months after someone is exposed to the hepatitis B virus. Now, some people are able to fight the infection and clear the virus. 90% or more of adults and older children who contract hepatitis B are likely to clear the virus from their systems within a few months and develop a full immunity. About 10% become what we call chronic or long-term, and the virus stays in the blood, infecting liver cells, damaging them over time, and causing illness such as cirrhosis, liver failure, or liver cancer. Infants and young children are most at risk from chronic infections, complications, and death. Further, in most children, the virus is a silent killer. It destroys the liver or introduces liver cancer, liver failure, or cirrhosis, often over a period of 20 years or more. It's estimated that up to 1.2 million people in the U.S. have chronic hepatitis B virus infection, and about 38,000 people per year become infected with HBV. Each year, about 3,000 people die as a result of liver disease caused by HBV. Infections have significantly decreased since 1990 because of routine hepatitis B virus vaccination. Symptoms are unreliable and may or may not be present. Only a blood test can determine the infection. But if you do see symptoms, they could include yellow skin, otherwise known as jaundice, yellowing eyes, tiredness, loss of appetite, nausea, dark urine, joint pain, abdominal discomfort, and fever. Hepatitis B is unique in that it's 100 times easier to catch than HIV. This is because the virus is very small compared to HIV. Also, hepatitis B virus can live outside of body for at least 7 days, and even much longer in the right conditions. Hepatitis B virus is primarily spread by sexual contact with an infected person, sharing needles and/or syringes. It can also be spread from an infected mother to her baby during birth, or from contact with blood and body fluids through breaks in the skin, such as bites, cuts, or sores. People who are chronically infected can spread hepatitis B virus to others, even if they don't look or feel sick. However, like HIV, it's not spread by casual contact like handshakes, hugging, doorknobs, or using the same equipment, toilets, water fountains, etc.
Applications in medicine. Over the past decade, significant advancements have been made with respect to treatment of chronic HBV, infection reduction in liver disease, and improved outcomes. There are several antiviral agents that are approved for the treatment of hepatitis virus, two of which, lamivudine and tenofovir disoproxil fumarate, are also licensed oral formulations for the treatment of human immunodeficiency virus.
Hi, this is Tom from ZeroToFinals.com. I wanted to make a video about interpreting hepatitis B serology. And this video is really concentrating on making it simple and easy so that you can really understand and remember how to interpret these results. This is a very popular exam topic and it quite often comes up in clinical practice as well, so it's a useful skill to have. And if you want more information on hepatitis in general, including the other viral hepatitises, then please go to zerotofinals.com/hepatitis. But let's get straight in. Firstly, it's essential to have a very basic understanding about antibodies, otherwise you'll find it extremely hard to understand hepatitis B serology. Antibodies are basically proteins that are produced by B cells. And there's millions of types of antibodies, and each B cell only produces a single type of antibody. And this single type of antibody only targets a single type of protein. The protein that's targeted by an antibody is called an antigen. So antigens could be proteins that are part of viruses or bacteria or funguses or cancers or even the body's own cells in the case of autoimmune disease. And the job of antibodies is to go hunting for their specific antigens. And when they find them, they attach themselves to that antigen, and then they help the rest of the immune system to launch an attack on whatever that antigen is and whatever the antigen is related to. In the case of hepatitis B, there are antigens that are part of the hepatitis B virus, and these are hepatitis B viral proteins. So let's start by introducing the antigens that are part of the hepatitis B virus, and then talking about the relevant tests to these antigens. So there's 3 antigens that I want to talk about on the hepatitis B virus: the surface antigen, the E antigen, and the core antigen. The surface antigen, which is what we call the Hep B surface antigen, is found on the surface of the hepatitis B virus. If we find that the hepatitis B surface antigen is in the blood, if the hepatitis B surface antigen is positive, then we know that the person is infected with hepatitis B. If there's no hepatitis B infection, then the virus wouldn't be releasing the surface antigen into the blood, so you'd get a negative result. It's important to know that the vaccination for hepatitis B involves injecting the person with hepatitis B surface antigen. So what happens is the immune system creates a response to this hepatitis B surface antigen, and then the person becomes immune to hepatitis B. If you test somebody after they've had the hepatitis B vaccine, then they'll be positive for Hep B surface antigen, because that's what you injected into the person's body, until the immune system responds and clears that antigen, and then they'll have a negative result after that. The next antigen to talk about is the hepatitis B E antigen. The Hep B E antigen is found between the core and the surface of the hepatitis virus, and it floats in this space in between the two. And it's released during replication of the virus. And remember, E antigen escapes, so E for escapes, during replication. Therefore, if you find the Hep B E antigen is present, it implies the patient has an acute phase of the infection where the virus is replicating very quickly. So the level of the Hep B E antigen correlates with their infectivity, because the virus is replicating very quickly. So if a person becomes exposed to that patient's blood, then they've got a high chance of becoming infectious. So if the Hep B E antigen is higher, they're more infectious.
Pros and cons. Given that the same antiretroviral drugs are being used for hepatitis virus prevention and hepatitis virus treatment, there is a potential for hepatitis virus drug resistance developing in people using tenofovir-containing regimens for HIV prevention.
Welcome back. In this video, we'll talk about the treatment of hepatitis B virus. To remember the medications, I remember this mnemonic: interferon latte. Interferon can be used in many viral infections, and it's very effective. Its effectivity stems from its potency, which also causes many side effects, which is why we use interferons as a last resort when everything else has failed. The most common side effects are arthralgia, depression, and pancytopenia. L is for lamivudine, which is actually an HIV medication from the class non-reverse transcriptase inhibitors. It works in hepatitis B virus because just like HIV, they're both DNA viruses and both use reverse transcriptase. A for adefovir, which causes renal failure if the patient is not hydrated well enough, just like acyclovir. T for tilbivudine, and T for tenofovir, and E for entecavir. And here's a small quiz for you. Which of the following is a type of vaccine against hepatitis B virus infection? The answer is that it's a subunit vaccine against the virus surface protein. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.
Issue applying Ecuador. In 2006, two of us described 3 patients with hepatitis B virus infection who were receiving adefovir and had unexpected treatment failure. Lamivudine resistance had previously developed in these 3 patients, and they had been successfully treated thereafter with tenofovir, which was not yet licensed at the time for the treatment of hepatitis virus infection.
Hepatitis B is an infectious disease. Particularly in its chronic form, it is associated with severe suffering and even death. The outcome of an infection with hepatitis B virus is determined by the individual immune response. If this is insufficient, chronic hepatitis B develops. After HBV has entered a liver cell, genomic HBV DNA is transported to the nucleus, where it is converted into covalently closed circular DNA. This ccc DNA functions as the template for the transcription of several viral messenger RNAs. These are exported to the cytoplasm and then either translated into viral proteins or packed into nucleocapsids and converted back into viral DNA. A newly formed virus is released from the cell, as is the hepatitis B surface protein, detectable as HBs antigen in the serum. If the patient's immune response is inadequate, the virus can proliferate. Among other viral markers, serum levels of both HBV DNA and HBs antigen rise. The HBs antigen level is an important diagnostic parameter. Persistent HBsAg levels are associated with increased risk of HCC. Clearing HBs antigen and/or seroconversion is closest to a cure in the treatment of chronic hepatitis B.
Conclusion. If we consider comparable antiviral efficacy, extremely low risk of TDF resistance, lower cost, and better safety potential, TDF monotherapy will be a reasonable option for the treatment of patients with drug-resistant CHB. Thank you.